Imagine a world where more women have the time to fully explore their genius. Welcome to She Rebel Radio, the UK's podcast for women leaders and founders ready to unlearn conventional rules and lead their businesses of significance. Hailed for counter-status quo ideas and a whole dose of feminine perspective, this is our International Women's Day series, sponsored by our headline partners, NatWest. My name's Lulu Minns. I host retreats and create spaces for women leaders to explore their genius. And today, I'm going to create that same space right here for you on this podcast. Welcome to episode 111 of She Rebel Radio. Embrace health with Dr. Olivia and Dr. Zoe Schaedel. Founder of Myla Health Clinic, Dr. Olivia and co-director Dr. Zoe Schaedel are GPs and menopause specialists, providing a medical service dedicated to helping women take control of their health and in turn their lives. Both are members of the British Menopause Society and provide local and national education for GPs, corporate clients and members of the public to teach about the menopause as well as sexual health. It's amazing to have you both here. How are you doing?
Fine, thank you. Thank you for inviting us on.
Thanks. Yeah, good.
Amazing. Olivia, you are the founder of Myla Health Clinic. What was your journey into starting a private health clinic, and why do you think women benefit from a bespoke medical service?
So both Zoe and I and all of our doctors who work at Myla Health, we still are firmly based within the NHS. So we work as NHS doctors and as private doctors. And that really works for us. So when I first started Myla Health, which was Women's Health Sussex, it was just a small sort of one afternoon a week clinic alongside my NHS work. And I'd just really become aware, I've been working as a GP for 15 years, mainly in women's health, just realising that women get a really poor deal when it comes to their health. They don't get enough time, they don't get the treatment that they really deserve or need. And and also menopause at that point really wasn't being talked about at all. And we were all really aware that this was an area of women's healthcare that was really lacking. And then it just potted along as a one afternoon a week clinic for a few months. And then the whole Davina McCall thing happened. And suddenly everyone was talking about menopause. Demand went up hugely. I had to take on new doctors. And then Zoe came and joined last year in order to just really help us scale up and expand. So we're doing lots of work. Firstly, we see patients, but we also do lots and lots of education, both within and without the NHS. And we also do a lot of stuff for corporate clients. So teaching corporates and teach organisations how to support women through the menopause, support women with their health.
Amazing. It's great to hear of that demand, going up and menopause being in the conversation. It's definitely something we've been talking about on She Rebel Radio as well. Zoe, I think you are reading the book Unwell Women. I received a copy for Christmas. I read the first few pages and I'm going to go back to it. It was a little bit like the other book in terms of Invisible Women, where you can feel the trigger of certain things of why have these things been missed for so long. Now, why is there inequality in women's healthcare? What have been your discoveries and experiences of this as both women and medical professionals? You just mentioned, the lack of time, treatment for women. Can you tell us more about that?
I think what we know is that so much of healthcare is based on research and evidence and care that has been designed specifically for men, and it's been kind of translated to women. And I suppose we have seen that so much in our clinical practice, is that actually so many of women's health problems really get in the way of their lives, and there's a real lack of effective treatments, or people struggle to get diagnoses, and also women over the years have really not felt listened to. So there's been a big women's health strategy that was published last year, and they did a huge survey of kind of health professionals but also of women themselves, and what really came out strongly was that women everywhere were saying that they had presented with something and they just didn't feel listened to or understood or offered any help. And that sense of having to sort of get on with something. So whether it's really heavy, painful periods that really affect, young people's lives, and we see that all the time, girls who have time off school because their periods are so awful for them, and they just haven't been able to kind of connect with things that would help. And again, we see that a lot, of course, in menopause. So there's been all sorts of controversies and scandals over the years that have affected menopause care. And I read a quote yesterday where the music died for women in the menopause in about 2002 when they published this really huge study that suggested that hormone treatment might be harmful or was harmful. And actually all over the years we've had these things that have meant women can't really be connected to facts and evidence that will really help them.
Yeah, and you've said that the medical system and it was designed for men and then it's kind of been translated for women. I'm going to ask you a little bit about that in a minute. And I certainly had that experience this year of not feeling listened to with a medical challenge that is female based, and I'm not going to overshare about that. But I've always been very lucky with my health, and yeah, I was quite shocked by some of the kind of advice or disregard of what I was kind of sharing with the medical team. But why has the medical system been designed for men? We know so many other things in the business world have been, but is there a particular reason for the medical system?
Well, I'm reading Unwell Women at the moment, actually, which is really interesting because it just goes back so far. And it's this idea that women are these sort of slightly weak beings that are enthralled to their hormones, and that their purpose is essentially to reproduce and then die, once they've kind of outlived their usefulness to society. And I think so there's this misogyny absolutely at root of the way that women are treated. So we know that women's pain is much more likely to be ignored and devalued, and that women are often given these labels of being hysterical or weak, when in fact I think Zoe and I would say it's absolutely the opposite. So most of the women that we see are coping with unbelievable amounts of sort of caring responsibilities. They're coping with work, they're coping with health issues. And there's this whole idea for women themselves that they should cope, that they should just put up with stuff. They shouldn't complain. And if they complain, they will be stigmatized as being sort of weak and hysterical. But actually, and that's really far from the truth. And unfortunately, although things are changing, and the wonderful thing about this focus on menopause is actually it's really shifted the focus to women's health full stop. And as Zoe said, this big consultation, if you read the results of it, it was women of all ages, sort of through, as Zoe said, adolescent period, through childbirth, through child rearing, and through menopause, just being constantly sort of belittled and ignored, and just their symptoms undervalued. So it's hundreds of years of misogyny, I think, but things are really changing. So I think things are positive. The right things are happening now.
Amazing. And is it true that, a lot of medical testing has been done on men because they don't have, the cyclical nature that we have in terms of data and variables, that almost women are too variable to measure against, or that was the belief when a lot of medical drug testing has been done? Is there any truth in that?
Yeah, absolutely. So because women's hormones change throughout the month, actually that, and we know how important those hormonal changes are on all sorts of things that happen in the body, it means that they are harder to put in studies and harder to measure, because you would have to take into consideration where they were in their hormonal cycle. And so it's just meant that all along men are easier to learn from, easier to study, because it seems more complex to look at it from that perspective, where you get this kind of monthly variation. But of course what we know is the more we can understand about that, the more we can understand about it, the better for everyone. As long as we continue to improve women's health, that helps us all in society. It's not just about women.
Yeah, absolutely. And as you've said, both of you there, in terms of all the additional things that women take on, when our health is suffering, that impacts in so many ways. Now, when was the British Menopause Society founded? Because as we've heard, menopause is now much more in the conversation. And how does that support us as women here in the UK?
So the British Menopause Society was founded in 1989. And the idea really is that they are the specialist authority, and they kind of are responsible for guiding research and education and information, particularly for medical practitioners. So they offer training courses, journals and that kind of thing. Really interestingly, they also have a fantastic arm for patients, for women themselves, called Women's Health Concern. And they have lots of resources available, just fact sheets, information, webinars, videos, that type of thing. So it can be a really good source of information. The British Menopause Society used to have about 600 members about 4 or 5 years ago.
Yeah.
But the expansion of the interest in menopause has meant that has quadrupled. It's gone up hugely in the last few years. The interest's been amazing. So really, it's about making sure everyone has the right information that they need on menopause, and that it's a consensus. So they look at societies around the world, all who are researching menopause, and try to come together and say, what is the best evidence? What do we know? What more do we need to learn?
Yeah, amazing.
It's really important, because I think what women, and it was great because when I started Women's Health Sussex, when I started Myla Health years ago, there was very little information about menopause out there. But now I think what women are telling us is that there's almost too much. And it's very, very difficult to work out, because a lot of people have hidden agendas. They have, there's reasons why they want to support a particular point of view, or people have read the evidence in a slightly different way. And the great thing about the British Menopause Society and Women's Health Consent information is this is properly evidence-based. As Zoe says, this is people who've taken the evidence, they've talked to other experts, they've come up with a consensus opinion. So people can be very sure that what they're reading from the British Menopause Society is the sort of the knowledge, is the sum total of the knowledge that is currently available, but with no agendas there.
Yeah,
so
kind of a neutral. A neutral view without a basis of trying to sell something or, get you to engage in something in particular.
Yeah, that's right.
Yeah, amazing. Now, we've had a conversation recently on She Rebel Radio with the founders of Red School. In fact, they're the only guests that we've had that have returned twice to She Rebel. And they do a lot of work around menopause, not just being a health issue, but an initiation for women to access our greater wisdom. What do you think is the wider impact of us as women not having the menopause or even our cyclical nature understood, in the wider world, but also in the medical world? We touched on it a little bit, but can we go a bit deeper with that? What is the wider impact, do you think?
Well, I think that women often have, when things aren't understood and really sort of integrated, that you get a fear about them. And I think the thing about menopause is lots of women see it as a really negative thing. And part of, like Olivia said, there's so much information now talking about all the problems with menopause. And that's brilliant to reduce the stigma. So it's great we're talking more. But then people can start to see it as something negative, something to be avoided, rather than really connecting to it as a natural phase. So like you say, really similarly to menstrual cycle as well. But actually, the menopause is a natural part of life. And for lots of women, it will be a really positive time. And actually, it can often represent a time when you're actually more freedom. You've got less responsibilities. You're more able to kind of listen to yourself, your own instincts, less about pleasing others, more about, being more yourself and having that self-awareness. And I think that we have to be really careful we don't lose that understanding. So we need to bring menopause and all the details about it to the forefront of conversation so women don't feel isolated or alone. But we also don't want to say it's something to be erased or taken away, or we can try and remove this phase of life, because actually it can be really brilliant.
I think that's really important. And I think we need to, I think for a lot of women are saying now that they're actually, there's a fear of menopause. So we're seeing women in their 30s and early 40s just terrified that they are going to sort of lose their minds and be ineffective at work, and that lots of health issues are going to arise from it. And actually, we need to remember that for many women, as Zoe said, this is a positive time of their life. Their periods stop. They no longer have to worry about contraception. So these are things that can be actually really empowering and can really liberate women, especially women who've really had a tough time with their menstrual cycle. And so we need to remember that actually it's not something to be scared of. And for women who are having severe symptoms, there is help out there and there is treatment. And I sort of worry sometimes because we go into the corporate world a lot and we talk, and it's brilliant that organisations are now really looking at supporting women. But I also feel that I've had some women say to me, I now feel that everyone is looking at me just wondering when I'm going to crack up. That so we need to be really, really careful in the message that we're giving to women and to the people around them, so that it's about being supportive. It's about a sort of time in your life where things are changing, but it doesn't necessarily have to be something that's really catastrophic.
There's lots of evidence about what might make the experience more positive. And part of what we want to do at Myla Health is help women to take control of their health. And one of the reasons for that is women who feel in control and understand and feel they have options have a more positive experience. So that's one of the key factors, is if you feel like you've got some options and you're in control of those options, you are going to have a better experience.
Yeah, that's incredibly important. And I think, as you've both said, there's something to really celebrate. It's less attachment to lots of things this phase in your life, and being really careful not to problematize it, if that's even a word. But and I think what's run through a lot for women in terms of, you know, medical attention, etc. And as you use the word hysteria, Olivia, is not causing women more problem in terms of needing to do a sanity check, you know, of like, am I, you know, is this okay, and things like that. So I can definitely see that road being paved, but a much more positive conversation being created as well with the likes of experts as yourself, in really shifting the narrative in a more positive direction. So it's great to see. Why is supporting women with the health aspect of menopause so critical? Zoe, I know a particular specialism of yours is starting a sleep clinic. How does that tie in with women's health and the menopause as well?
So sleep is really important. Women are very different to men with sleep, and actually all throughout life, the way that women sleep is slightly different. And actually women have much higher rates of insomnia, of having, you know, losing sleep, waking up lots through the night. And that can happen as part of the menstrual cycle. So we know that sleep is worse at some points and better at some points, but particularly at the menopause. So the majority of women will notice some changes to their sleep, and they're usually not good changes. And they will often find that they, out of the blue, start waking in the early hours of the morning. And this, I really feel that sleep is one of the core symptoms to really try and look at when someone's experiencing symptoms of the menopause, because it has so many knock-on effects. So when you're not sleeping, you're more likely to be more anxious, you can struggle at work, you have more brain fog. It often limits women's quality of life. And for a really long time, it's been difficult for people to access treatment that will work. So often experiences, if they seek help, they're offered a sleeping tablet or something like that, and they're just not very effective. They don't work that well. They can be addictive, and they've got lots of side effects and problems. So when I was seeing so many women in the menopause struggling with their sleep, I really did lots of extra education myself to understand what can help. And there are lots of ways to help sleep. You have to think about things from, lots of different factors, like lifestyle, like how we're living, like the activity we're doing, like how we go out in the light in the day. There's all sorts of things, and our hormones. And when you put all those things together, you can make a real difference to sleep. There are some really effective treatments called cognitive behavioral therapy for insomnia. And so I founded a clinic called the Good Sleep Clinic, exactly so that people would be able to access those treatments. And we work really closely with them at Myla Health as well.
And also, it's part of what we try and do at Myla Health is offer a really holistic approach to the menopause. And often I think 40s and 50s is a time, as Zoe was saying before, a time of reckoning for women. Often people have got over that sort of initial bit of kind of really intense career focus or intense focus with young children, and it's a time to then start to, or we encourage them to start thinking about themselves a bit. So it's not just about sort of medicalizing the menopause, it's about talking about sleep and about diet and about exercise and about stress management and all these different things. And often our appointments, which we're so lucky at Myla Health, we have 45 minutes to an hour with each woman. And we can really explore all these different aspects to their health. It's not just it's not just saying, oh, you've got hot flushes, try some HRT. It's much, much wider and broader than that to support women.
Yeah, it's not just papering over kind of symptoms that may arise. It's really getting to the root of what's needed, by the sounds of it.
Absolutely, yeah.
Now, the NHS, I probably had more contact with the NHS in the past year than ever, with a parent who's been unwell as well. There's currently a crisis going on, strikes and lack of pay. You're both still working in the NHS. Is the system still working, or do we all need to start looking at more private healthcare?
Oh, it's such a difficult question. Because the NHS obviously is so many different things, isn't it? It's an enormous organisation, and some bits of the NHS are still functioning actually really well. I think for many people, if you need emergency care, or if you need cancer treatment or something like that, a lot of bits are still working. I think it is under a huge amount of pressure. I think we're all really suffering with staff shortages, and with just the pressures of work. And I think people are really suffering from that. And I know a lot of my patients, I'm a NHS GP, a lot of my patients are beginning to sort of pick and choose the bits of private medicine. So for instance, what they're paying for is time. They're paying for going to sit and have a good bit of time to discuss with a specialist where they should go, and then they'll often go back into the NHS. So I think what's happening more is that people are beginning to sort of mix and match. But obviously what we need to be really careful is that those people who can't afford private healthcare don't get excluded. And so we're constantly at Myla Health trying to do as much as we can outside the NHS too. So we educate a lot of GPs, we do a lot of talks, and we do a lot of talks to patient groups, for instance, things like breast cancer support groups. And so we're really trying to make sure that everyone is supported, whether they can afford private healthcare or not.
Yeah, that's amazing to hear. And in terms of, I will add, it's not a negative experience. I've had some incredible care and then some concerns, but mixing and matching is a very good, kind of response. And I think when you can really deep dive with your patients as well on a private basis, that does have a knock-on effect, in terms of the education and what can be put back in to the NHS for sure. Now, how can we embrace our health in 2023 as women leaders? What are some of your top tips?
I'm going to go with sleep to start with, Lulu. So it is my favourite topic, but I think that we're running a business. We are also working in the NHS. Everything is so busy. And I know that that's often women are under so many different pressures. They have young families or, caring responsibilities. And I think that actually prioritizing your sleep, making sure that you're going to bed at the right time, that you're actually having a bit of time to wind down before, really makes a difference. It's the core thing that I think will really help people thrive in the daytime.
And there've been more difficulties with that, Zoe, with technology and phones and all of that. Do you think that has an impact?
Yeah. So, and we know that screens, not only are they, this kind of brightly lit device, but they also hold on it all sorts of either tempting, stimulating, or stressful. Most people have their work on their phone as well as their social life. So having easy access to that right up until the point of bed can be really harmful for lots of people, particularly young people. Lots of young people struggle to put their phones down and go to sleep, and they're up really, really late, early hours of the morning.
Yeah. Olivia?
And I would say I think a theme that comes across we just talk to women all day, and the themes that come across all the time is this idea about coping, and that somehow coping means subsuming all your own needs to the people that you're caring for. And I think a lot of what we do as clinicians is saying, and I always use the oxygen mask analogy, if you've got to look after someone, you've got to put your own oxygen mask on first. And so what I'm constantly encouraging women to do is to step back and to actually look after themselves for a change. And if it makes them feel easier to think I'm looking after myself so that I can care better for others, then that's fine, whatever it takes. But actually just to start, it's not seeking help doesn't mean you're not coping. Seeking help is a really good thing to do. So if you are struggling, do seek help, step back from everything, just give yourself some time, and try and work out how you can look after yourself.
Yeah, and it's true to say, isn't it? The more people that you're supporting, the more support you may need yourself, or some level, somewhere, and not doing it all ourselves. And the International Women's Day theme is embracing equity. And we're tying that theme throughout She Rebel Radio and this International Women's Day series. What 3 things are you going to be embracing in 2023 as we kind of move into the year and out of the winter?
Zoe?
One of the things we've been thinking about embracing, actually, Lou, was our dogs. So there is a good reason. So I'm a bit further along the journey than Olivia, but I have two dogs, and it's made an absolute difference to my life. So I've not had animals ever before. And over lockdown, we decided as a family to get dogs. But really, they are wonderful. They've brought such a joy to my home life, our family life. To have a dog's life in your home is a really lovely experience. And also, it does get me out. I get walks, and I enjoy the mindful aspect of that a lot. So I love getting out into nature. Now, Olivia may not be quite there yet, because she has just got a puppy and may not. So I don't know what you would say about that, but I think it is something to embrace.
Yeah, I think absolutely. And I think, again, it's part of that. So I, like many women, I'm sure listening to this, spend absolutely no time looking after myself at all, because, you know, I love my work, I have my family, I'm just doing things all the time. And actually, the one thing that having the puppy, despite it completely ruining my life, has done is made me actually, as Zoe said, that mindfulness of actually going out into the countryside, and just being, you can't do anything else apart from look around and just enjoy being out there. And so it's about, as Zoe said, being more mindful and really enjoying the real beauty around me, the beauty in life. And luckily the puppy, despite being a real pain, is actually really encouraging me to do that. So that's what we decided, one of the things we would embrace in 2023.
Yeah, amazing. It's that real encouragement. Well, maybe not so much with a puppy, but slowing down. I love, as you said, Zoe, I get taken for a walk. So the dog's taking you for a walk instead of the other way around. I've had two cats. One of them's 16 and one of them's 13, for a very long time. And they always do remind me to slow down, because cats meditate a lot of the time. They're sitting there purring, chilling. They remind me to slow it down and take it down to a lower pace of life, which is so needed. The busier and again, technology, how everything has sped up over the last kind of 10, 15 years is really important.
Yeah, absolutely. And I think another thing we're hoping to embrace even more is really collaborating with other wonderful women. So since Myla Health was born, we've had the opportunity to work with some fantastic women, some fantastic businesses, other professionals. And it really does just make us feel like we're growing and growing all the time. And we just want to see more of that in the coming year.
Because this has been such a journey for us. We've been in the NHS for, I don't know, 20 years or so before we started doing this. So this business world is quite new to us, but it's just so exciting. We're just really, really enjoying this opportunity, as Zoe said, to work with people. Just the opportunities that are coming our way have been absolutely fantastic. We're now scaling up with getting clinics in different cities in the UK. We're now on social media. We've finally got onto Instagram, and so lots of opportunities are coming through that. So that's all really exciting, and it's just this spirit of work, of collaboration, has been so great. It's been wonderful working with often with other women who, instead of trying to compete, there's been a lot of real support and women helping each other up, which I think has been really amazing to see.
Yeah, and starting your own business really creates that. A lot of creativity is born, isn't it? Where suddenly you've got this kind of free reign to do and create what it is that you want. And I often call collaboration a feminine principle, and something that we do very naturally as women in terms of supporting each other and co-creating and all of that stuff. Is there a third thing that you want to embrace in 2023?
So you said something when we were talking about this, about your trusting our instincts. That was what you were going to.
Yeah,
say.
I think a lot. Yeah, when we think about women in the menopause, quite often we are helping people really listen to their body, listen to what's right for them, and really start to trust themselves and not be scared of what's going on, and make good choices that are right for them. And I think that's something that we are having to learn as well in our business, is about feeling what's really right and knowing that in our core about what our purpose is. We want to make a big difference for women and their health. And I think we know women's health. We've done this for a really long time. And so I think we really need to lean in to what our instincts are telling us about what the right way to do that is. Like Olivia said, we've had so many opportunities and options, and sometimes we feel pulled in millions of different directions. And I think sometimes we just need to really step back and think, what do we know is the right way to make this difference?
And this where our core, and Zoe and I have always been very clear. One of the reasons that we work so well together is because our core values are exactly the same. And so sticking to our core values, which is about absolutely, I mean, to go back to the women's, to the theme of International Women's Day, about equity. So there's an awful lot we could do. We could sort of leave the NHS behind. We could leave our idea. We could go fully private. We could just have clients who are professional women who can afford us, but that isn't what our values are. Our values are about equity of access to healthcare, and that is really, really important to both of us. So that is, and so what we've learned, I think, with all these opportunities is to always come back to our core values and to see, does this opportunity match with our values? And we have turned down some really amazing opportunities because we felt that they didn't quite match with what we wanted to do at Myla Health, and it's getting that confidence to be able to say no to some things and to really stick to our important values. I think that's been a really big learning process for us.
Yeah, that values are such an important filter. And Zoe, I was going to say, in terms of that mirror there of trusting yourselves, it was quite significant in terms of, you know, as you will both know, when you start a business, there's an overwhelming amount of information and ways to do it. As you said, you know, with the menopause now, there's an overwhelming amount, and you have to trust what's right for you. And as women, you know, it really is a gift that we can tune in with that. But again, I think, you know, the world has conditioned us to not trust ourselves and what it is that we know. And I love seeing, and it's a big part of the work that I do really, in supporting women to have that shift in trusting what it is that we know and how we want to move forward with things. So what is next for you at Myla Healthcare, and where can we find you?
Go on, Zoe.
We've got all sorts of things planned. So we're really growing the number of face-to-face appointments we offer. So we are in different areas. We've just launched a clinic in Kent in Sevenoaks. We have a clinic coming down in Devon. We've got a clinic in Sheffield and Derbyshire. And so we're really growing the number of face-to-face appointments that we can offer. We're also doing more work with different organisations, and that's going to be really exciting. We've, as Olivia said, we're trying to use social media a bit more as well. So we're just on Instagram, and we're trying to develop that. We've got some really exciting projects, just talking about our values as well, to work with some charities that are really focused on women's health and improving women's health. And that's a really exciting focus for us this year.
Amazing. Olivia, anything you want to add?
I think that was it. And then the other thing is expanding our corporate offerings. So we've been doing a lot of corporate work, but in a very ad hoc basis. So people have been sort of contacting us on LinkedIn, and we've worked for some really big organisations and some really small ones. But we've just sort of finalised our corporate offering, and now we're trying to work out where we go with this and how we sort of get things out there. Because what we've got, which a lot of the corporate menopause organisations don't have, is that we're doctors. So when we go in and people ask us questions, we are able to answer giving really good evidence-based information, and also our experience of having sort of 20 years working in healthcare. And so the times that we have been into organisations, it's been incredibly positive, and we've had really, really good feedback. So we're just trying to work out now sort of how we expand that and how we offer that to more organisations.
Amazing. It's really been really great to meet you both recently at our Female Founders Away Day as well, and to have you on She Rebel Radio. I know the audience will really resonate with what it is that you share and what it is that you do. So thank you so much for being with us today.
Thank you for having us. It's been lovely.
Yeah, no, thanks very much.
You've been listening to She Rebel Radio. We thank you for listening and thank our headline partners NatWest for sponsoring this series. If this episode has inspired you, please pass it on and share with at least one other incredible woman. And don't forget to hit subscribe and leave us a review. You can find out more about me and my work at luluminns.com or on most social media platforms.